We are here as Ugenya Foundation to sponsor a free medical camp while working in partnership with several other players, including the Ministry of Health itself, ably represented here by the Director General of Health, Dr. Moth. We also have here the Director of KMTC, Dr. Kelly Olwoch, and several other doctors and partners from the private sector to facilitate this medical camp. As you are aware, it is a planting season and also a weeding season in equal measure. But people can't go to the farm when they are sick. That's why we felt it is imperative that we organize this medical camp. We organize this medical camp so that all those who are sick can get treatment, and then we all go to the farm so that we can enhance the productivity levels and have adequate food in homes at the end of the harvesting season. So there are several ailments which will be attended to today by the team of doctors who are here. Dr. Moth will explain that. But as you are aware, as a Kenya Kwanza government, health is at the center of our plan. So as we do this, we are augmenting the efforts of government in provision of health to the people. Yeah? So that we can enhance the productivity levels and also get adequate food for purposes of sustainability. Both food production, agriculture, and health are integral pillars of our Kenya Kwanza plan. So the timing could not have been any better because of the planting season and the weeding season. And the timing also is good because most people in the recent past have not been able to get medical attention because of the challenges that you know. Yeah. Let us also be responsive to what is happening in our operational environment. Yeah? This last 1 week, we have witnessed loss of lives of Kenyans in their prime ages because of the floods. I want to take this opportunity to augment the statement that was released by the President yesterday but one, that our people need to move away from the riverbanks. Yeah? Our people need to move away from the riverbanks so that we don't expose ourselves to unnecessary danger. Weather is unpredictable, so you do not know when the water will overflow. So let us take precautionary measures and move away from the riverbanks. But also in equal measure, let us embark on massive planting of trees during this rainy season. This rainy season poses the challenge of flooding, but it is also an opportunity for us to plant trees so that we can have sustainability in the environment. We are facing challenges of drought once in a while because most of our green zones have been depleted. So I want to appeal to Kenyans to plant trees, as many trees as possible, especially in this region. Our tree cover is still very low compared to other parts of the country. Let us take advantage of this rainy season to plant as many trees as possible. All of us, not just government officials, all of us as Kenyans, from each and every household, let us plant trees during this rainy season.
Just to echo, one is to start by thanking Waziri Eliud Owalo, CS for ICT, and Eliud Owalo Foundation for bringing this medical camp. This comes at a difficult moment for the country. We know the challenges that we have gone through in terms of the doctor strike, but also now the heavy rains that we have had with flooding, putting the lives and health of the people at risk. Therefore, this camp comes at a good time to be able to address some of the ailments our people suffer from. It is also an opportunity for us to be able to do what we call community diagnosis by screening for various ailments when we go through the triage process, but also an opportunity for us to impart health education to the people, especially with the challenges that we are facing now. We are going to offer a broad spectrum of services from general consultation, screening for non-communicable diseases including diabetes, hypertension, and specifically screening for cervical cancer. We'll have immunization services. We'll have an eye clinic amongst many other services that we are going to offer today, and also be able to establish a pathway for referral for cases that will not be able to handle at this particular camp. But we also want to take this opportunity to impart health education to our people. For example, now with the heavy rainy season, contamination of water sources, the importance of boiling water, cleaning your foods and fruits before you eat them, cooking your foods in a healthy environment, dealing with general wastes so that you can be able to clear bushes around your home to be able to reduce incidences of mosquito breeding and therefore incidences of malaria. So it's a good platform for us to be able to know the general health of this community, but also to be able to dialogue with them and also offer basic preventive, curative services and link them to the next level of care. This has not been possible, cannot be possible without the support of other partners through the foundation. We have partners including National Syndemic Disease Control, AIDS Healthcare Foundation, Kenya Dental Association, Ruai Family Hospital, Chronic Diseases Society in Kenya, amongst many other partners who have come together with us to offer this service. So we have a team of more than 30 doctors, both from the county government of Siaya. We have doctors from Kisumu, some from Nairobi, a few colleagues from Eldoret, and we're also working with the community health promoters because as a country we are trying to popularize primary health care. The health and well-being of every individual begins with yourself. So through the community health promoters, then we can be able to link you along the entire continuum of care so that we can be able to prevent diseases that are preventable. But of course, if it requires curative care, then you can be able to access that service. Yes, we have put measures in place through the multi-agency team as established under the leadership of His Excellency the Deputy President. So our role as the Ministry of Health is to ensure essential healthcare services are provided at the medical camps and the necessary preventive and promotive measures are undertaken to be able to ensure safety and health of Kenyans who are in various camps during this difficult period. So we have put measures in place to ensure we chlorinate water, safe disposal of waste. We have immunization teams, outreaches through the community healthcare system and the primary care health system to ensure that especially women and children under 5 years are protected. We have also distributed food rations to ensure that pregnant mothers and children under 5 don't suffer from acute malnutrition, and also offering immunization services so that children don't miss out on those critical services, antenatal clinics through inreaches and outreaches to the various camps.
Mimi ni Joseph Odhiambo Omolo, natoka sehemu za Ukwala na nimefurahia matibabu ambao tumepewa kupitia kwa kwa Walo Foundation, Eliud Walo Foundation. Maana kwa mara ya kwanza tumepata matibabu ambao kuna madawa ambao tumepewa bure bila kulipa kitu chochote, na madawa iko kadhaa, sio kama treatment camps zingine tumeenda ambazo tunaandikiwa tu vitu na tupewi dawa. Kwa hivyo nina matumaini kwamba vile nimepimwa na nimepewa madawa nitapata kupona.
Mimi naitwa Rebeko Onyango, ninatoka huko Ukwala Ward. Nimefurahia sana matibabu yenye kiongozi wetu Mr. Eliud Walo ametuletea hapa Ugenya. Tunajua ya kwamba tunaenda kufaidika kwa sababu ukiangalia hapa watu wengi wenye wako hapa kwa laini ni wale ambao wajiwezi. Tunajua ya kwamba wamama, wazee wanaenda kupata matibabu na inaenda kubadilisha maisha ya wengine wetu ambao tumekuwa kwa vitanda, hatuwezi kuamka tukafanya kazi zetu. Tumeshukuru sana. Wacha Mungu akaendelee kumbariki.
ne wayudo sirkal manyien mane piny mar president marwa Dr. William Ruto, to sirkandno ne oyier jaluo achiel kende e cabinet mar president. Wan gi minister achiel kende ma thurwa ka gi
How many people are left without just 2 people. The rest are okay. Just do it. If you go the sizing way, let us bring
we have antipsychotics, we have antihistamines, anti-allergies. Okay, we have anti-diabetics, just for diabetes. We have antihypertensives, that is for pressure, low pressure. We have drugs for control the clotting system. There. We also have bronchodilators, drugs for asthma. Yes, bronchodilators are there. Yes.